Good afternoon. Thanks for everybody for being here. I want to thank Dr. Roberts and Columbus Public Health, the great leaders at City Council, Councilmember Shayla Favor, Council President Hardin, been working so hard on this and engaging with the community. Thrilled to have our neighbor to the east. He often describes Columbus as a small suburban community of Bexley, but having Ben Kessler, the mayor of Bexley, with us here, he's been a very courageous leader on some of these issues, and we've been following his lead and working with him as well as some of our neighbors throughout the region. So thrilled to have Ben here today. Dr. Ashley Ebersol from Nationwide Children's Hospital. And then to close us out today with a pretty powerful message from a young person's perspective, we'll have Frankie Badowski close us out. It's a pleasure to join you today, along with our partners from the medical community, to announce my support for prohibiting the sale and distribution of flavored tobacco, including menthol, in the city of Columbus. Let me be clear, this is a public health issue. It's also an equity issue. We know for a fact tobacco companies have been deliberately targeting the sale of their deadly products at children and Black Americans for decades. Data from the Department of Health and Human Services shows that tobacco is the leading cause of preventable death in the Black community, killing 45,000 every year. And the overwhelming majority of those deaths are caused by menthol cigarettes. None of this is a coincidence. It isn't by chance. It is, however, the direct result of a sustained, calculated campaign that includes selective marketing, predatory pricing, and an abundance of free samples made conveniently available to the Black community and to first-time smokers. And then there are the retailers who carry these products. Many of them are intentionally located near our schools and oftentimes in our most vulnerable neighborhoods, closing in on a customer base they deem to be a high priority and a lucrative source for future sales. The end result is a multi-layered and malicious marketing strategy conceived of and perpetuated by the tobacco manufacturers themselves, carefully spelling out to whom they advertise, where they set up shop, how they entice new customers, and how they instill dangerous, unhealthy habits to keep their youngest customers coming back for more. For any other enterprise, much of this would be considered business as usual: marketing, advertising, a robust network of retailers within arm's reach of their most sought-after customers. But there's nothing acceptable about an industry that willfully preys on the safety and well-being of our community to prop up their profit margins. Ending the sale of flavored tobacco, especially menthol, would have a dramatic impact on longevity and quality of life. According to the FDA, banning menthol cigarettes nationwide could prevent as many as 654,000 deaths in the U.S., including 238,000 African Americans over the next 40 years. What's more, I'm confident that other communities will follow our lead. By acting now, we can ensure a ripple effect that expands the reach of our efforts. Mayor Kessler, as I mentioned, from the city of Bexley, is here to talk about what this work means to him and his community. Our neighbors, many of whom we've talked with, are considered flavored tobacco legislation in the months and year ahead. Dublin, Hilliard, Whitehall, Worthington, Reynoldsburg. It isn't enough for a single city to take these products off the shelves. We need others to do the same. We believe that helping to keep all of our neighborhoods safe and vibrant and transform our shared aspirations into collective action. When I asked Dr. Roberts to declare racism a public health crisis back in 2020 in partnership with the Board of Health, These are the exact type of actions that she and her team have recommended to continue to call out systemic racism wherever it lies in this community. And that's not enough. You also have to own the remedy to address the way that systemic racism impacts people, families, children in this community. And I'm so grateful for Dr. Roberts and her team at Public Health. I wanted her to come up and talk a little bit about this issue through the public health lens. It's my pleasure to introduce our Health Commissioner, Dr. Mashika Roberts.
Good afternoon, and thank you so much, Mayor Ginther. Columbus Public Health is truly proud to work with you, Mayor Ginther, as well as Columbus City Council to help prevent the health damage and disparities caused by flavored tobacco right here in our own community. Over 2 years ago, as Mayor Ginther mentioned, he declared racism a public health issue. This declaration was not only a call to action for Columbus Public Health, but all of us in this community. Since then, we have been working really hard to improve the health and quality of life of all of our minority residents. This proposal to ban flavored tobacco is in line with the work that we have been doing and further supports our efforts to address health disparities right here in Columbus. The bottom line is banning menthol and flavored tobacco products is a matter of health equity. I'm going to repeat that. The bottom line is banning menthol and flavored tobacco products, or the sale of those products in our community, is a matter of health equity. Local legislation will improve the health of Black and brown residents while also addressing the vaping epidemic that is preying on our kids. Legislative interventions on flavored tobacco are important because, as Mayor Ginther said, flavors are used to hook kids as well as minority communities on nicotine. And nicotine is very, very addicting. Simply put, vulnerable people in our community are targeted for addiction. The statistics in our community are alarming. 1 in 4 Columbus adults currently smoke, 1 in 4. 39% of adult Columbus smokers are Black. 1 in 3 of all Black Columbus residents smoke. And nationally, from the 2019 data, 85% of Black smokers use menthol cigarettes, 85%. The health and economic toll is staggering. 4 out of the 5 leading causes of death in Columbus are exacerbated by tobacco and/or e-cigarette use. And according to the Health Policy Institute of Ohio, cigarette smoking cost Ohio $6.8 billion with a B dollars in health care cost. Yet, there are 804 licensed tobacco retailers in Columbus. Many of them are concentrated in socially vulnerable neighborhoods with large numbers of African Americans. Sadly, youth and people of color are often hooked on tobacco right in their own neighborhoods, close to their own homes, their work, and their schools. We can and we must do more to prevent youth and minority populations from going down this path of a lifelong tobacco addiction. Banning flavored tobacco is a positive step in preventing people from using tobacco in the very first place. Banning menthol and mint-flavored tobacco products is a matter of health equity and addresses one of the great historical causes that has made racism a public health crisis here in Columbus as well as across this country. Columbus Public Health will continue to work with our partners to find solutions that will decrease disparities in smoking so we can achieve optimal health for all of our residents, no matter their zip code, no matter the color of their skin. And now I would like to introduce our next speaker, another great partner we have here in Columbus, Dr. Ashley Ebersol. Dr. Ebersol is the Assistant Professor of Clinical Pediatrics in the Division of Adolescent Medicine at Nationwide Children's Hospital. Thank you.
Thank you so much, Dr. Roberts, and for Mayor Ginther for having me today. As Dr. Roberts said, my name is Ashley Ebersol, and I'm a physician at Nationwide Children's Hospital, where I've worked for 7 years. I practice adolescent medicine and work in our substance use treatment and recovery program. In our program, we treat patients who are addicted to nicotine and other drugs. Nationwide Children's Hospital supports the flavored tobacco ban, as it will limit the use of e-cigarettes in children, which can lead to addiction and negative health outcomes for children, adolescents, young adults, their families, and our community. Tobacco use begins almost exclusively in adolescence. According to the Centers for Disease Control, nearly 9 out of every 10 adults who smoke cigarettes daily started before the age of 18. Every day in America, 1,600 youth smoke their first cigarette. In 2021, 4 out of every 5 high school students and 3 out of every 4 middle school students who used tobacco products in the last 30 days said that they used flavored tobacco products during that time. Adolescents and young adults are developmentally vulnerable to addiction, and addiction happens quickly, sometimes even during that experimental use phase before they're smoking daily or regularly. The availability of flavors is among the most prominently cited reasons for youth e-cigarette use. Studies reveal that candy or fruit-flavored e-cigarettes are more appealing than tobacco flavors to adolescents and young adults. Adolescents perceive that e-cigarettes with flavors are less harmful to them than those with tobacco flavors, which creates a potential misperception that e-cigarettes with flavors do not contain nicotine. I have many patients who told me that their vape does not contain nicotine. They don't understand that they are harming themselves. Flavorings, other than menthol, have been banned in traditional cigarettes since the Family Smoking Prevention and Tobacco Control Act of 2009, because flavorings encourage youth experimentation, and regular use may result in addiction. The American Academy of Pediatrics actually recommends that all flavors, including menthol, are banned in e-cigarettes as well. By banning fruit and candy flavored e-cigarettes, children and adolescents will have less access to these addictive and detrimental nicotine products. With COVID-19, we've seen an increase in depression in adolescents. Adolescents often turn to substance use to self-medicate. Medical visits for adolescents for evaluation of substance use has increased since COVID-19. Vaping is detrimental to the health of children. In addition to the long-term consequences of tobacco use, such as lung cancer and heart disease, adolescents may also suffer from e-cigarette or vaping product use-associated lung injury, also called EVALI. The consequences of this lung injury may result in hospitalization and death. Additionally, defective e-cigarette batteries have caused fires and explosions. Both children and adults have been poisoned by swallowing, breathing, or absorbing e-cigarette liquid through their skin and eyes. Nationwide Children's Hospital is committed to policies that champion children's health and support the best outcomes for kids. We believe that flavored tobacco ban will limit the access of flavored tobacco and prevent harmful health outcomes for our children in our community. Thank you, and up next we have Mayor Kessler from Bexley.
So let's start with the good news. We know that public policy can make a difference. We know that over the past decades that consumption of cigarettes among our youth has dropped precipitously. The bad news is that in the wake of that drop, the market has figured out very clever ways to replace addiction with flavored vape products that present as candy. And I think it's kind of insane standing up here and talking about the fact that we are banning a product that is designed and marketed towards our youth with flavors that are circulate around candy and fruit. Bexley, a couple years ago, Bexley did ban flavored vape products. But we're a 2.5 square mile in the middle of a very large, thriving region, and any effort that any of us does on our own is not enough. The other good news is cities are leading the way. leadership, from Mayor Ginther and from leadership here in Columbus, from other local suburbs in Columbus area will make a huge difference. It will save lives. It will result in changes to public policy that will then percolate into other regions throughout the state and hopefully the entire state of Ohio and hopefully the country. If we ban flavored vape products in Bexley and our kids can just walk across the street to Berwick or Eastmore and purchase products, it doesn't do any good. Likewise, if Columbus bans products and somebody can walk across the street into Upper Arlington or Westerville or Dublin, it does not do what it needs to do. So we do need to approach this as a region. I'm proud that we in Bexley also have an ordinance very similar to Columbus's ordinance that we hope to pass next week. I know that there are many other peers among our cities here in Central Ohio that are working on very similar legislation. So we're excited to be part of a regional approach, and thank you again to Columbus for their leadership. What you really need to listen to, though, is the future. And so I am very honored to be able to welcome Frankie Medosky to speak with us today.
Hello. Hi, my name is Frank Medosky. I'm a 17-year-old high school senior. I'm currently surrounded by minors who abuse flavored nicotine products. Actually, did you know that many of the disposable vapes sold are 5% nicotine? This includes top-selling brands like Vuse, Elf Bars, Hides, and others. According to the health website Single Care, 63.5% of vapers are under the age of 18. The customers purchasing these flavored nicotine products are people from my age range, 14 to 18 years old. The high percentage of nicotine leads to higher addiction levels. For example, at these critical developing ages, the brain is still highly impressionable. Nicotine also changes the way synapses are formed, which harms the parts of the brain that control attention and learning. With a staggering 63.5% of vapers under the age of 18, we all must do better in prevention. While the remaining age range for people vaping is 18 and over, leaving only 36.5% at the legal age to consume flavored nicotine products. Even though the law states that you must be 21 to purchase the flavored nicotine products, it is still easily accessible for minors. Many of the stores selling these products do not even require proper identification from minors purchasing the flavored nicotine. In addition to improving prevention, we should also enforce stricter penalties for businesses selling the flavored nicotine to minors.
Thank you so much, Frankie, and appreciate your voice and advocacy. As we've said, these products are purposely funneled within reach of youth and children. The strategy is simple. Hook them while they're young, and get a customer for life. Well, that simply cannot stand in our community. Too much is at stake to allow tobacco manufacturers and their products to harm the youngest and most impressionable among us. The implications extend far beyond childhood. Adults in our community struggle to escape the power of addiction too. And by then, adverse health effects are already settling in or have taken their disastrous toll. In many cases, the damage is irreversible. From reduced longevity and increased medical costs to debilitating chronic conditions and a life experience marked by greater hardship, expense, and adversity. The consequences are as wide-ranging as they are long-lasting. We have an obligation to act, and we're encouraging council to do so. Together, we will do what must be done to protect the health, safety, and well-being of this community. Together, we will protect our residents from the dangers of menthol cigarettes, flavored tobacco, empower everyone in Columbus to live longer, healthier, and more prosperous lives. And a message to those who have maliciously and strategically targeted our young people and our African American neighbors. Your days are over. They're coming to an end. We encourage you to be part of the solution and work with us to protect the young, the most impressionable, the most vulnerable in our community. But it's time for us to act. The time for discussion and study is over. We'd be happy to take any of your questions from the press. If it's anything about today's announcement, we'll take them here. If you want to ask, you can ask me about anything under the sun, but I ask you to hold those maybe for one-on-ones afterwards to respect the time of our other speakers here today. Any questions from the press? Yes, sir.
You know, in the light of all the crime in the city, some might say, why are we bothering with this? Why not tackle the bigger problems?
I think the lives of African Americans and young people are worth the courage and leadership to act. Those issues are top of mind. They're our number one priority. But the public health and safety of all of our neighbors should be a top priority for all of us. So we are doing unprecedented things and making great strides in reducing violence. If you take a look, violent crime, homicides are down nearly 30% because of the great leadership and work of Chief Bryant and the incredible work that she's doing there. But this is an area where we declared as a community that racism was a public health crisis. Well, it's one thing to declare something and to study something and to acknowledge there's a problem. That's not enough. You have to own the remedy. And this is a small part of a larger remedy to address what systemic racism has done to our neighbors here and in places around America.
We know that City Council has been holding lots of hearings about this and hearing a lot of feedback, including from a lot of business owners. What is your message to business owners who are fearful about how this will impact their businesses, many of these business owners being minorities themselves?
We think this is something where we can work together. And we can figure out ways to support these businesses moving forward when they're not targeting African Americans and young people in our community. I think this administration, this community has demonstrated very strong support to small and local businesses, made unprecedented investments through small business economic development grants to entrepreneurs, small business, particularly where there are owners of color. We're going to continue to do that. We just can't allow for, any entities, whether they're huge tobacco companies or small stores that target through flavored candy, type of vapes, menthol cigarettes, and those types of things, young people and our neighbors. Any other questions?
Have you heard from or spoken to any of the CEOs or higher-ups from these companies?
I have not. Thanks, everybody. We'll stick around. Nice talk.